Thank you, Cecilia.
Good. So good morning, everyone. It is a pleasure to welcome you at the European Healthcare Climate Summit. This is the 5th edition of the summit that Healthcare Data Europe is organized. Only the second one in person. The first one in person was in London back in 2019. And then we hosted online. And finally, this year, we were able to host it again in person. So it is really a pleasure to welcome you and having you in person. The European Healthcare Climate Summit brings the climate smart healthcare community together to exchange best practices, ideas, and challenges, all the challenges we face in building a greener, healthier future. We're particularly excited to bring everyone together so we can tackle emissions hotspots in healthcare, and we're looking forward to a fruitful conversation with you all. Today in the room, we have a very wide and diverse array of expertise as we welcome speakers and participants from all over Europe. We have Italy, Spain, Belgium, UK, Denmark, Germany, Slovakia, Georgia, Netherlands, Switzerland, Poland. So the list is very long, Romania, France, Ireland. So I invite you to really take advantage of the networking session. We'll have like coffee break and lunch to exchange more on your work. Our speakers today are driving change as doctors, nurses, midwives, sustainability managers, waste and facility managers, procurement, researchers. Everyone has a role to play in decarbonizing the sector. So it's an honor to host you today, and we look forward to seeing how a varied experience enrich our collective dialogue in addressing climate change. Before we dive into today's agenda, I'd like to say a few words about Healthcare Without Harm Europe, as we have a lot of new members. The clicker. Okay, great. So just a few words about us. Healthcare Without Harm Europe is a network of thousands of hospitals, healthcare leaders, healthcare professionals with members across Europe, and we have partners across the globe. Together, we prove that it's possible to deliver the highest quality of care in a way that is sustainable financially and environmentally. Our mission is to transform the healthcare sector, and through our program and projects and network, we aim to innovate medical practices together with our members, shift the culture, and influence and transform global and European local policies, because we know that we can have good practices, we can have a right culture, but we also need the right policy framework to do this type of work. If you look on our website, it might seem a complicated organization. You just have to remember we have 4 action networks. We have the Global Green and Healthy Hospital is our network of hospitals and healthcare providers. And then we have 3 networks for healthcare professionals, like GPs, doctors of green and healthcare, or nurses and pharmacists. So this is a snapshot of the members we have in Europe. The number is not updated there. I think we're over 190s now. These apologies for this thing, but so its membership keeps growing. So it's difficult to keep the slides updated, which is a good thing. And we have 3 program areas. So 4 action networks and 3 program areas. Climate smart healthcare, I don't think you need to be educated on this. You have circular healthcare, so it's looking at embedding the circular economy practice into healthcare, and safer pharmaceutical. So in the circular healthcare, the goal is to drive European health, drive the markets toward toxic-free products that conserve finite resources, minimize waste, and contribute to ethical supply chain and circular economy. We have different action areas. One is looking at green chemistry, so projects like safer disinfectants or PVC-free alternatives, procurement resources. Some of you were at our circular healthcare training yesterday, so learned more about this type of resources. We worked a lot on plastics. We did waste audits in hospitals and different pilot projects. And now we are in the launching phase of a new pilot project about eco-maternity and pediatric units in hospitals. And we also work on advocacy, influencing the Global Plastic Treaty, EU Green Deal, and offer training opportunity to our members. Safer Pharma, the strategic goal is to set that pharmaceutical pollution and its contribution to development of antimicrobial resistance is minimized. Again, we have 3 action areas. There is the work on awareness raising campaigns and involvement of pharmacists in inventory of good practices to prevent pharmaceutical pollution. We have projects on AMR. We're about to launch a report on AMR education in Europe and AMR educator training for doctors, pharmacists, nurses, and managers. And then we're again involved in the policy advocacy fora related to AMR and the European pharmaceutical legislation. Climate smart healthcare is the topic of today. We want the European healthcare sector that is transformed into net zero and climate resilient sector that protects public health from climate change and accelerates the transition to a low carbon economy. The 3 areas are decarbonization, resilience, and advocacy again. So today the event will touch upon all these different aspects in looking at particularly procurement or the hotspot of the emissions. But this is what the event is about. It's about giving the opportunities to our members to exchange best practices, network, and training opportunities. So this is all about Healthcare Without Harm Europe. Brief overview of the agenda of today. First, we will hear from our keynote speaker, Maria Gaiden, who is the head of the department of the Center for Sustainable Hospitals in Denmark. Then we will move into 2 back-to-back sessions on emissions-free supply chains. The first will tackle single-use devices with Lisbeth de Maar and Katrien van der Wee from the Hospital of Ghent. And the second will focus on pharmaceuticals with speakers Francesco Baroni Adesi and Dr. Josep Guyu Segura. Then we will have a short coffee break in the room next to this one where you had coffee this morning. And we'll then resume with a shift to focusing on healing environments. So the first session will concentrate on sustainable and resilient hospital buildings with our speaker, Maria Stamenkovic of the Capital Region, Denmark. And the second will concentrate on climate smart transport solutions with speakers Kate Townsend and Paul Flattery of Hampshire Hospitals. Next, we will join a vegetarian lunch with option for all the data needs that you requested, and also take a group photo. So please stay. And after the lunch, we will focus on moving from theory to practice. So we all have our breakout session. So we will have the opportunity to engage in deeper discussion with also with the speaker with 2 sets of 2 parallel sessions. The first 2 we focus on sustainable procurement of pharmaceuticals and climate smart healthcare buildings. And then the guests will have selected which one of the session they would like to attend the registration. And the next 2 parallel sessions will focus on sustainable procurement to move away from single-use devices and developing climate smart transport solution. If at any point you're not sure which breakout session you registered for or would like to change, please let us know. There is our colleague Vies and Mai in the room that you met at the registration desk. So they have the registration and you can see in which breakout room you are assigned or if you still need to register. Finally, we will conclude the day enjoying a drink with closing remarks from our climate program manager, Mireia. And it will be followed by a reception to network and celebrate the conclusion of the GRACE Summit. Before we begin, just a few housekeeping notes. So the restrooms are here out of the door. Then the emergency exit are marked with the green sign. And yeah, so please feel free to contact any member of the team here in the room if you need anything during the day. We will also be recording today's plenary presentations to make session available online after the event. And we also invited a film crew to capture the event. So you may see them filming during the breaks too, but don't worry because they're just recording like the images, but not recording any audio. So feel free to speak freely also in the breakout room. You will not be recorded. It would be great if one or two you might be also open to be interviewed on camera during the breaks, just to say how was your experience with the summit today. And yeah, so if you're open to that, please let our colleague Hope to know in the room. She's waving at the back of the room. So if you want to be interviewed, yes. Thank you, Hope. Okay, so I think we're good to start. Let me introduce our first speaker, Maria Gaiden, to give our opening keynote. Maria is the leader of the Center for Sustainable Hospital in Central Denmark region, focusing on transitioning towards a circular economy in the clinical setting. Please, Maria, welcome on stage.
Thank you so much, Ariana. And thank you all for coming today. I don't know how you got here, but I flew. I felt glad and I felt guilty. And I shared the airspace with, I know, a bunch of private jets on their way to Dubai. I'm not quite sure we shared both emotions, what do I know, but we shared the airspace and we shared the purpose of gathering to talk about the climate change and what it means to us. And that agenda is, of course, more relevant than ever. The purpose is clear because the concentration of CO2 in the air is higher. I didn't feel it up there, but I know it based on the IPCC report. It's higher than ever, and it's racing faster than ever. In 2022, we set yet another depressing record of heat and of the number of CO2 particles in the air. Now, the last record before 2022 was set in 2019, and the year before that was another record. So was 2017, so was 2016. You see the pattern. Now, 2020 and 2021 broke that pattern. And that was because COVID-19 broke our patterns of behavior as human beings. No, not very many at least, was sharing the space up there at that point of time. And let's just pin that as a note to all of us, that the patterns of behavior of human beings can be changed. We'll get back to that. During the last 40 to 50 years, about 50% of all wildlife on the planet has been extinct. About 75% of all flying bugs have been extinct. About 80% of all forestation has been extinct. Thank you. On the contrary, the amount of human beings have grown with about 1 billion. This Friday, I turned 42. So all of this has happened during my lifetime. Now, on a positive note, I'm not even halfway through my life, I hope. So hopefully, I will see as big a change as the one I've just described for you, just in the opposite direction, in the same short amount of time that the rest of my life represents, just as it did in the first part of my life. And with all these changes going on, sometimes it's like we ask ourselves, who should we pity? Should we pity all the animals that have extinct, that have a poorer life, frame for their life? Pity all the forests and the oceans that are losing the life forms? Or should we pity humans who, as a result of climate change, will be threatened on our possibilities of living a healthy life. I think if you're in this room, you do know that WHO has defined climate change as the biggest threat to human health in the 21st century. Should we pity ourselves? Because we will feel the climate change. We will feel the weather changes, the extreme weather, the temperature rising, the water rising. Big areas of the planet will be uninhabitable and uncultivable. There will be changes in the resources. There will be changes and disturbances in the supply chains of both food and also the medical supplies. So should we pity healthcare as well? Because the picture of diseases and the burden of diseases will be more complex. It will be bigger. Our task is growing. At the same time, these disturbances in supply chains will affect us as well. We can feel it already. More pandemics. It will be harder for us to get what we need to have in order to do what we're doing. The products needed to treat the patients will be harder to reach. They will be more expensive. It's a very poor business model. We're running a business on a use of single-use devices and raw materials that are limited and that will be harder to get and more expensive. It's really not a sustainable business model. So maybe we should pity ourselves a little bit too. But really, pity is not the thing. Pity is not a very constructive feeling. It's something we feel when something should have been done differently, when we realize that we should have done something else, that we've lost something. So what we need to do is probably to care more. The three words that's framing today, health, care, and sustainability, the combination and the force of combining these three words, I really think is what we should be talking about. We could start with the first word, care. What is it to care about something? To me, it's to be aware of the value that something or someone represents to me. That I have acknowledged and realized that something actually means something to me, even though it is not mine, and that it does not necessarily benefit me personally here and now in a capitalized way, but it means something to me. So I care about it. I care about nature. I do care about all the animals. And I do care about health. And health is the second word. And what is health? Aaron Antonowski, who is an American sociologist, defined health as a feeling of a comprehensible, meaningful, and manageable feeling in life that gives an individual a feeling of coherence. He was really occupied with what he calls salutogenesis instead of pathogenesis. That means being occupied with the origin of health, not just the origin of diseases of the pathogen area. So if this comprehensible, meaningful coherence thing is like the basic issue of health, it really mirrors the fact that health is not created within the healthcare system. It happens in our everyday life if we have access to what will cover our basic needs and our social and emotional needs. Then we get this feeling of coherence. And that means that sustainability, the third word, should be in the center of healthcare. If we care about health in that definition, we should be concerned with sustainability as well. These three things goes together in a very powerful way, in my opinion. So the last word, sustainability, is maybe even harder to define than both health and care, I think. Sustainability is, to me, some sort of field of perspective. It's a center of our awareness and the way we do our things. It's an operational strategy, you could say, or value, emotion, maybe. Sustainability is acknowledging that many things in this world, I almost dare to say everything, is connected, that the level of complexity in society and in life in general is extremely high. And every time we try to ignore that and reduce complexity within a task, within whatever we measure upon in order to figure out if something is working or not, every time we do reduce that complexity, we do not remove it, we just ignore it. and we ignore the consequences of the choices being made. Let's say we made a choice saying everything in a hospital has to be sterile. Focusing on whatever we could measure of effect that would have positive, maybe, I don't know, on the number of infections occurring within the hospital setting. Now we could focus on that, reducing the complexity and just focusing on that effect on health, not focusing on all the other effects of health it would have. The insecurity, people being scared about more things, more examinations, a lot of more products being used. How does that affect health? So sustainability is, to me, a willingness to try to meet the complexity as it is, trying to prioritize, trying to do what will do good for the longest time, for the most people. I'll try to give you an example of what I think is important we look into when we talk about sustainability and healthcare. In my everyday life, as Ariana mentioned, I am leader of Center for Sustainable Hospitals in the central Denmark region. I have a background as a midwife, so I know the clinical settings from the inside as well. In Center for Sustainable Hospitals, we try to support all the hospital units and the psychiatric department, social area as well, in the transition towards circular economy. Not saying that sustainability is circular economy, it's more than that, but about 80% of the negative impact on climate and environment from a Danish hospital setting stems from the scope 3. That's why circular economy is somehow in the center of our operations. We've had a project running over a couple of years where we've been looking into the operational theaters, looking at hip surgeries. We asked all the hospital units in the region to weigh the single-use equipment they were using every time they did one of these surgeries, because we do a lot of them. We do a little over 2,000 just in our region in a very small country called Denmark, which is not a city in Sweden, by the way. It's a very small country. There are 5 regions, the demographic development, everything just points in a direction saying we're going to do a lot more of these operations. So we looked into them and weighed all the equipment, single-use equipment, and it varied within the same region, within the same guidelines and procedures, demographic combination of people in the area, the same tenders, products, whatever. It varied with 40%. The lowest consumption was 7 kilograms and the highest was 12.5 kilograms. And the quality and the outcomes for patients were about the same. That's an important detail, of course. So we try now, of course, to figure out how can we make everyone consume in the lowest level, because that would be good. If everyone did that just in our region, we would reduce the waste amount with 8 tons per year. And that was just the hips. Then we do have the feet, the knees, the elbows, the back, the fingers, the head, whatever. You can try to multiply it up and think, oh my God, that would be like 1,000 tons or something we could save just by looking at, so how do you do things? How do I do things? Let's find the best way to do this. It's just common sense. It's not innovation. It does not take a lot of money. We save money doing this. It's really, really simple. So we try to do that a lot. The clinicians play a central role in these kind of changes. However, I have a very good colleague of mine who sometimes uses the expression saying, sustainability, when we talk about the change, we should do good, not less bad. And the problem with all these exercises that we do, that I'm leading myself, is that we are doing the same things better. We are operating in a better way. We are giving the anesthetic gases in a better way. We are trying to reduce the waste of medicine when we use medicine to do it in a better way. But we're still not really doing good. Because even though we do reduce the consumption of all these operational types I tried to mention, let's say we save 2,000 tons of CO2 in the central Denmark region. Now, if we want to reach our strategic goals in the central Denmark region, saying a reduction of CO2 with 70%, the total waste reduction with 30%, and so on, you can read our strategy online if you want to. We have some strategic goals, which copies the Paris Agreement, basically. If we want to reduce the right amount every year from now on till 2030, we have to reduce 34,000 of tons per year. So you see, even if we do all of our operations in a better way, we will not reach the goal of 34,000. The key of reaching that goal is to prevent half of the patients or something from ever needing that hip surgery. And then we are back to what is it to care and what is health. Health is not getting a hip surgery in the most sustainable way. Caring of health for a healthcare system is figuring out how to prioritize whatever it takes to make sure that people never need that operation. And if you look at the life science industry and the healthcare industry, I had the pleasure of being at a debate at the UN General Assembly in New York last month. And yes, I did fly over there as well. Sorry. The Danish Minister of Health introduced the debate, and she talked about how the health industry in Denmark was such a success, and it is. It's really a big industry, and we're very good at it. And she also mentioned sustainability. But it struck me again that this healthcare industry, all it really does is being focused on the pathogenesis, back to Antonovsky, focusing on how to treat diseases. Where are the successful companies in Denmark as a life science nation, or in Europe, where the core business is prevention? We don't even know what the business model looks like. How do you get extremely rich from making people exercise and eat healthy? We need to figure that out. We need to explore that market opportunity, or figure out how to make it an opportunity, if we want to crack the curve, really saying that health is what we need to care about, not just treating diseases. With all respect, of course, for everyone who's trying to do that better. So what we're looking at is really a systemic change. It's a transformation. It's a shift in paradigm. The clinicians play a central role, but this change takes leadership. It takes political awareness. It takes visionary people really stepping up. And it takes more than that. Because if you think about it, then every systemic change and every practical creation in this world that has ever happened basically consists of two things. It consists of someone's imaginary power, of someone's visions, of something that is not there yet, but could be here. And then it consists of their capability and willingness to act upon it. And that goes from everything. You could say a scissor. Someone at some point of time thought, oh, that would be cool if we could take like two knives and then like put them together and they could like do this. That would be cool. And people say, what? But someone actually imagined that to be possible and acted upon it, made a lot of prototypes, tested it, and wow, boom, now it's there. We don't even think about it. To a car, to a CT scanner. I mean, can you imagine the first guy thinking, what if we could like look through people's body? Wouldn't that be cool? Yeah, but someone imagined that and someone acted upon it again and again and again. And so with the system surrounding us, the healthcare system in Denmark is free for everyone. At some point of time, someone imagined, what if we could make someone pay a bit of tax or a lot of tax, and we can do this and that and the bureaucracy, and wow, it's free for everyone. Can you imagine that? It's possible. Someone acted upon it, and someone keeps acting upon preserving what is working. So if we want a sustainable healthcare system that cares much more about health than just treating diseases, then we need to start imagining what it looks like, and we need to act upon it. And going back to the COP28 and the people I was up there with, and the Paris Agreement, there's so much imaginary power in all these vision and all these goals, as well as the SDGs. People have really imagined and calculated what needs to be done, what is necessary, what should be possible, what can we envision as a future we are hoping for and longing for, needing for. But when we look at the numbers, returning to the very sad record that 2022 was according to temperature and particles in the air, it tells us that the imaginary power is right now not balanced well enough with the capability and the willingness to act. So my hope for today, with all these words I spoke to you, is that you take the rest of the day and forward from that on. And you use your imaginary power to imagine what is the really good solution, not just better, they have to be good. And then you act upon it. And you keep balancing these two forces, saying, I imagine something and I act upon it. Then I stop and I imagine, okay, maybe it's not working, I need to adjust. Act, imagine, act, imagine. Keep doing that exercise and we will move forward. But if we're stuck with our visions and our goals and do not act enough, we won't move in a pace that's fast enough in order to what we're losing right now that is valuable to us, that I care about, nature and health. So let me finish with one last sentence, quoting a Nobel Prize winning chemist called Ilya Prigogine. Maybe some of you know him. He was an expert in complexity and the movement of things. Really interesting. He said, the best way to cope with the future is to create it. Thank you. I have to stay.
Oh, this doesn't move. Maybe we can say. Thank you very much, Maria. Very inspiring keynote speech. Just a quick question for summing up. We were discussing yesterday at the circular healthcare training for those of the room that were with us. We said, someone said there's no glory in prevention.
No.
So how are you in your work? How are you aspiring to push hospitals in looking, at both how to do things better, but also how to work on prevention and to tackle, to have a more holistic approach when it comes to sustainability, health and care?
It's a good question, and you're really hitting a soft spot, or what do you call it? Because we don't do it enough. That's the true answer. But we try to start the debate. And there are organizations I know worldwide, as well as in Denmark, called Choose Wisely.
Yeah.
And we try to hook up with them and make them our new BFF, because they really hit the spot, saying that let's look at all this low value care that we're doing. Because, I mean, there are many steps. Prevention is one thing, and prioritization and low value versus high value care is another agenda that's basically about the same thing. But people do get sick. We will never be completely rid of that. So when they do, we also need to look into low and high value care. So they are a very important player, I think, in this field. And then I try to raise the awareness politically whenever there is an opportunity. Because I actually think there's a lot of glory in prevention. The problem is there's no money in it. To be honest, I mean, that's a big problem. Yeah.
Thank you. Well, thank you for opening the summit today. Again, the clap from my way. Thank you.